Hi, I'm Michelle Billman. I work for the Marshall Project, and we are excited that you all are with us today to talk about this really important topic of surveillance of pregnant people and the various ways that the Marshall Project has been covering this issue in the last few years. The Marshall Project, as many of you know, covers the criminal justice system in the US. We are a nonprofit, nonpartisan newsroom. And then I run a program called Investigate This, which is an effort by the Marshall Project to share criminal justice data sets and other reporting resources with local journalists and with researchers. So we'll talk a little bit about that today as well. But I'm very excited for you to get to hear the presentations of our award-winning journalists who have been digging into this topic. I'm going to hand it over to our moderator, Carrie Aspinwall.
Hi, I'm Carrie Aspinwall with the Marshall Project. I'm so excited that you guys are here with us today. This is a really important topic that Sho and Jill and I and everyone at the Marshall Project is very passionate about. It's an undercovered area, frankly. It's a tough area to write about and to get information and data on. So I'm really, really excited about what Jill and Shoshana have built for you guys here, and they're going to walk you through it and some tools that you can use to do, local projects off this. And then I'm also going to talk about some of the work that I've done later on, and guide you through like what to look for, where you can get data when it exists. So thank you for joining us, and go ahead and take it away.
So I'll be starting with just a brief overview of some of our more recent stories on this topic, and then I'll go into the origins and a little bit of the science and implications of these policies. But these are a few of the stories that the Marshall Project has done that you may be familiar with over the past couple of years. They're basically about hospital drug testing policies of pregnant patients and how those drug testing policies have led to women getting reported to authorities over false positive drug tests, triggered even by something as innocuous as poppy seeds. So hospitals drug test for various reasons. This policy really got started during the crack cocaine epidemic of the 80s and 90s, when pregnant women, predominantly Black and brown women, were really demonized for their drug use during pregnancy. And there was a lot of concern that ended up being quite a bit overblown about crack babies and how these children who are exposed to crack cocaine in the womb would develop. So hospitals began drug testing mothers. The result of that was skyrocketing foster care caseloads, babies being held in hospital nurseries for long periods of time, being separated from their mothers, and of course, mass incarceration, predominantly of Black and brown drug users. And during this time, states really began to pass laws requiring hospitals to report the births of babies who were born substance exposed. And states began classifying prenatal substance exposure as child abuse and neglect. Fast forward to the opioid epidemic. It started out as a pain pill epidemic. It was mainly at first impacting white communities, but there was similarly a lot of concern about neonatal abstinence syndrome and babies being born suffering from withdrawal symptoms from exposure to prescribed opioids. And so hospitals began rapidly expanding their drug testing policies. And now we're in a climate where there are many hospitals across the country that drug test every single patient who comes in to give birth, while others have more limited criteria. Say someone has had little prenatal care during their pregnancy, or they have certain pregnancy conditions like hypertension, or even bad teeth is one hospital policy that I heard about. And then other hospitals leave it up to the subjective decision making of their individual providers, which you can imagine leads to a lot of race and class bias. What studies show is that Black women, Native American women, Hispanic women, and women on Medicaid are most likely to be drug tested when they go in to give birth. They're most likely to be reported, and they're most likely to be investigated. Michelle, you can go to the next slide. So the drug tests that most hospitals use are fast and super cheap, but they're extremely imprecise. One toxicologist that I interviewed described it as kind of like a fishing net. A fishing net will will catch all these fish, will catch salmon, for example, but it'll also catch fish that are the same size as salmon, that look like salmon, or may not be salmon at all. For example, a tire or some other detritus that landed in the water. So these urine drug screens are kind of the same, operate the same way. They are meant to detect illicit substances, but a lot of what they detect look like illicit substances, but aren't. For example, prescribed medications like prescribed opiates or ADHD medications can look like meth or amphetamine and pop positive on one of these screens. And then there are lots of substances that are not illicit substances that end up looking like illicit substances on these screens. For example, labetalol, which is one of the most commonly prescribed medications for pregnant women for high blood pressure, can trigger false positives for meth and for fentanyl. And women have been reported as a result of these positive screens. So they're very easy to misinterpret, and they have false positive rates as high as 50%, a very, very high false positive rate. And the other limitation of these tests is that they don't tell you how often someone used, how much they might have used. They're really not the best way to identify someone who has an actual problematic chronic substance use disorder. And what's also really unusual about these drug testing policies is that in other realms in society where we drug test, for example, workplace drug testing, most workers who are drug tested on the job are entitled to more precise testing. So maybe they start with a urine drug screen, but then by law or regulation, they're required to receive a second, more definitive confirmation test. And they're often entitled to a review from a specially trained doctor who can determine whether the positive test was caused by an illicit substance or a prescribed medication or a substance the person might have eaten. That's not the case for people who go into the hospital to give birth. In the vast majority of states, a pregnant woman who goes into the hospital to give birth is not entitled to any of these protections that many other people are entitled to. And under law, hospitals have discretion over whether or not to drug test. But once they do drug test and they have a positive result in hand, our state-by-state review of policies and laws found that most hospitals are required to report that positive screen or positive test or potential exposure. So there's a great deal of incentive for hospitals to report these very imprecise, highly inaccurate drug test results. Michelle, you can go to the next slide. These are a few examples of false positives and misinterpreted drug tests from our reporting. On the left is a very brief, very short, this is not comprehensive at all, but a very brief short list of foods and medications that can trigger false positive results. One of the ones that I'm most shocked by, in addition to poppy seeds, is that very common baby wash products that are used in hospital nurseries can trigger false positives for THC in newborns. And then on the right-hand side are excerpts from medical records from a couple of women that we wrote about. My Salinas is a mom from Texas who gave birth a few years ago. Sadly, she gave birth to a stillborn child. She went to the hospital, losing a lot of blood, had to have an emergency C-section, was grieving the loss of her child in her hospital room, recovering from all that, when someone came into the room and asked her why she had tested positive for benzodiazepines. That positive test, I had no idea. She didn't even know what a benzo was. That positive test triggered a months-long investigation into Mai and her family that was extremely stressful during a traumatic time. And it wasn't until I got in touch with Mai and we requested all of her medical records, I was looking through all of them, that we realized that the hospital had given her the exact precise medication that she had tested positive for. And no one had checked or no one had thought to question the result when they reported it to authorities, which is very common. There are a lot of hospitals I have found do not have policies around interpreting drug test results or reviewing prior medical records to determine if the positive might have been caused by a medication that a patient was administered by the hospital. Same with Victoria Villanueva. She gave birth in Indiana several years ago. A very painful birth. She was given morphine during labor. When she went in to give birth, she actually screened negative for any substances. But after receiving the morphine, delivering her child, the child was drug tested. The child tested positive for morphine, the exact substance that was administered during labor. And you can see the drug test result here, and in Mai's case above, you can see the exact time in her medical record when the specific benzodiazepine midazolam was administered to her. You can go to the next slide, Michelle. So research shows that the best thing for a baby who's been exposed to illicit substances, even if the mom has an addiction problem, is to keep mom and baby together. The best treatment for a baby struggling with withdrawal symptoms is skin-to-skin contact, breastfeeding, to basically retain the comfort of this person that they've been with for months on end. And studies also show, decades of studies show, that there are better outcomes for mothers and for families when a mother is allowed to obtain treatment and retain custody of her children. What these drug testing policies often lead to is the opposite. They often trigger mandatory reporting policies, automatic reports to child welfare authorities, and those reports will then lead to intrusive investigations, family separations, and safety plans, which often require new moms to be supervised by responsible adults. And I've seen this in cases even when a false positive has been proven. A couple examples from our reporting include Susan Horton near Santa Rosa, California, who ate a poppy seed salad, a salad kit from Costco with poppy seed salad dressing prior to going in to give birth. She tested positive for opioids. That positive test, even though Susan had the receipt from the salad kit, she knew it precisely when she ate it. She had no red flags in her record, a very experienced mom of 5. She was reported to child welfare authorities, and child welfare authorities ended up removing her newborn for 2 weeks. Melissa Robinson, a teacher in Huntsville, Alabama, had a false positive screen for cocaine when she gave birth. That hospital actually did order a second, more precise confirmation test. But prior to receiving the results, they reported the positive screen to child welfare authorities. And the confirmation test eventually came back negative, proving that she had not used cocaine. Child welfare authorities still kept that investigation open. Melissa was required to be supervised by her own husband with her newborn baby. And that is now on her record. So these positive drug test results lead hospitals to report the results to child welfare authorities. And then often child welfare authorities will report the results to the police or to prosecutors. And that was the focus of our more recent story. I'm going to hand it over to Jill to talk about that.
Hi, everybody. I'm a data journalist with the Marshall Project, and I'm here to talk about our most recent reporting that Shoshana and I worked on that published earlier this year, and to tell you about, the reporting that went into it, but also the data that we gathered and published. So the data that we're talking about today is available to you to use or explore on your own. So some of the findings to get us started here, the key takeaway from this story is that we found 70,000 cases that were referred to police or prosecutors by child welfare agencies over these allegations of substance use during pregnancy. That data covers 21 states in a 6-year period. Gathering this data was very complicated. It involved, not only going to the original source of the data or going to the place to retrieve the data, which was the National Data Archive on Child Abuse and Neglect, but then going back to all the state agencies that submit data there to ask them to verify whether the numbers were correct or not. And that process took pretty much a year to get the data that we did get. In the end, we only got data for 21 states, so we feel very confident that what we have here is a significant undercount from the reality. We were also able to narrow in more on certain states and find some interesting details. One thing we were able to do with our analysis is compare the referral rates to the number of births in each state. And we found that in Oklahoma, out of the 21 states we have data for, Oklahoma had the highest referral rate to law enforcement. So 1 out of 24 births in Oklahoma actually resulted in one of these referrals by child welfare to law enforcement, specifically over allegations of substance use during pregnancy. And not every single case that we're talking about here involves, false positives, but we know that it happens frequently. There's also commonly misinterpreted results, like people testing positive for prescribed medications, that if somebody examined the test results closely, they would understand that this was a provided medication by a doctor. So in 2 states where we were able to get more detailed records, we found thousands of new mothers reported to law enforcement over prescription medications that they were given during pregnancy or childbirth. And of course, with this reporting, we spoke with people affected by these policies, women who've been interrogated by police shortly after giving birth, women who were jailed and prosecuted for testing positive for all sorts of substances, legal substances, poppy seeds, CBD gummies to alleviate nausea, fentanyl, which is something women can be given in their epidurals. So we always try to emphasize that this isn't just a set of numbers here. These are real lives, and people have been really negatively impacted. So what's interesting about this process, like the little flow chart Shoshana showed before, child welfare can decide to involve, police or prosecutors, and the data doesn't differentiate. What we have doesn't specify how many of these referrals went to police or prosecutors. But once police or prosecutors are involved, they're doing different things. Child welfare oftentimes are looking at, the safety of the child. That's a lot of their stated intention has to do with, is the child okay to be in this home? Was there abuse or neglect? Was there maltreatment? Do we need to set up a plan to keep this child safe? Once they involve law enforcement are looking at criminal investigations for the possibility of arresting and charging somebody with a crime. That's often what's happening when the police get involved. And so because they're 2 separate pathways, you actually end up with a lot of cases where child welfare decides, actually, there's no safety concern for the baby, but the police decide we're going to go ahead and make an arrest or investigate anyway. This happens more often than I expected to find in the data, but what we found was that in 15 states, more than half the time, the cases that child welfare are referring to police over alleged substance use, actually child welfare didn't find there was any abuse or neglect at all. Yet these cases get referred anyway. And if you go to the next slide, we can look at some of what that looks like in our data. So we made a drop-down menu available in our story where you can select your state and learn more about what we found there. And the level of detail really varies depending on the state. But in some states, we have this level of detail where we've got these black bars and we've got these orange bars. Black bars represent cases where the child welfare suspects or finds that there could have been abuse or neglect by the parents. And these orange bars are cases where they did not find any abuse or neglect by the parents. Yet, every single bar here, every single case, black or orange, these were all referred to law enforcement anyway. The reason being that Minnesota and many other states refer every single case from child welfare to law enforcement, regardless of the facts of the case. Even if there's a false positive, it doesn't matter. They are obligated to report those cases to police anyway. One of the states that we focused on in our reporting is South Carolina. and records just from two police agencies show what this means in practice. What it means is that police are getting forwarded potentially, paperwork showing the test results, like Shoshana showed earlier, and they're having to make a determination on whether they think that warrants a criminal investigation or maybe an arrest. Two police agencies alone in South Carolina, the data there showed that there were more than a dozen mothers arrested solely based on positive drug test results, without interviewing the women or collecting more definitive evidence. And I think Lieutenant Larry Williams, who we interviewed in our story, explained it really plainly when he said, "We always try to err on the side of the baby. My level of proof is it more likely than not? Is there probable cause enough to believe that you did this?" Which is, I think, really, really interesting to hear the perspective of police, that they believe that this is in the best interest of the baby, despite what Sho shared earlier about how removing, a baby or a mom from that bond in the early days can be very damaging. Another thing we did, I talked about how there's only 21 states where we were able to get this detailed data on referrals. But we know that there's a huge network of laws and statutes all over the country that matter everywhere. Even in states where you don't have the data, we wanted to be able to tell you about what's happening in all states across the US. So we went state by state to every child welfare agency and collected as much information as we could about policies in places where we couldn't even find the data. And we grouped states into three buckets. The dark purple here are states where child welfare, there's 13 of them, automatically shares every allegation of substance use during pregnancy with law enforcement. Then you've got these light blue states, which are states where this kind of information sharing and referral to police and prosecutors is rare and would really only happen if there's other concerns about abuse, neglect, or crimes, but that just a positive drug test, for example, would not result in a referral to law enforcement. And then you've got this in-between color, this light purple here, which shows states where they refer these allegations of substance use during pregnancy to police or prosecutors some of the time, but not all of the time. For example, in Louisiana, only after child welfare has substantiated the drug use will they then refer it to police. That's a bucket that's sort of in the middle, and every state there is a bit different. But we also wrote up summaries of each state's policy, and if you hover over them on this map, or you look at our drop-down menu, you can see what we wrote and fact-checked with each state about how it works. There's lots of ways that you can explore the data, and whether that's looking on the left-hand side, these are states where we have data on referrals to law enforcement, but in our drop-down menu, some data we have that's available. In states where we don't have referrals, we still try to make as much data available on the topic as we can. So I'd suggest checking out the states that you're interested in and seeing what we have there. I also wanted to mention that we published a full methodology and made this data fully available for download for your use. This data has never been published before, and it's cleaned up, and you can learn all about it, the process we went through to get it, but also the caveats you need to know in order to use it in your own reporting. And lastly, this is a great resource, our Investigate This toolkit, which we worked on to make this reporting more accessible to other journalists. You can learn more about the data and the limitations of hospital drug testing, like Sho talked about. You can use our visualizations, which we make available to you. There's also a FOIA template there if you're interested in putting in some requests in your own state. Or if you want to learn about finding impacted sources or the best styles and standards. There's a lot of detail in there, and I really hope you get a chance to take a look at it. You can also request a consultation with us if you have questions or want to learn more. and
Okay,
curious.
awesome. No, you guys, thank you for this. It's so impressive what you guys have done here. You guys had to put so much work into this. Sho and I always talk about this because we've been reporting on different sides of the same issue for so long. But Sho typically covers like more of the child welfare aspect of it and the positive testing. And then I've written about the criminalization and the court side of it a lot. But this is really where the two sides meet up, and having this data set is so important. Um, did you guys get into the chat? I was going to remind you, there were some questions in the chat. Somebody wanted to know if someone got their baby back, and there was another really detailed, great question about mental health. So while I'm rambling on, if y'all want to get there and answer the chat, and there was a really nice comment in there, we'll get your questions when we're done here. But this is just a topic that I became aware of. It was something I was always interested in, but in early 2022, The Frontier, which is a news outlet in Oklahoma where I live, and I was an early founder of, they published this really great investigation into a couple of prosecutions of miscarriage and stillbirth that were going on in the state. And I sent it to my editor. I said, I think this is really important. We need to do a story. And she said, well, okay, but you have to find more than 3 cases in Oklahoma. So I ended up teaming up with one of the reporters from Oklahoma and another very excellent reporter from Alabama, and we found more than 50. How we did that and why there's not a toolkit for this is that it's really complicated. Every state is very different. Courts run at the county and district level, and prosecutors really run the show in their county. They really are the ones driving the decisions about prosecutions. Alabama is probably the easiest one in that they have a very specific statute that addresses this specifically. But it's not easy because you have to be a resident in Alabama to request records there. We were able to do that. One of our reporters is from Alabama, and we were able to obtain a court records set there. And then South Carolina has been doing it longest, so they have the longest history of it. And now Oklahoma has come up, as you saw in the data that Jill was talking about. They're doing this more and more. They're one of the fastest increasing. But we found at least 9 other states, and this project ran in 2022. So there's been more states since then, but we found at least 9 other states, going back a period of about 23, 25 years, where prosecutors had started to embrace some sort of fetal personhood in bringing criminal charges after a miscarriage or stillbirth, alleging that it was caused by somebody's substance use. Many of the prosecutions resulted in lengthy prison sentences, some as long as 20 years, and life-altering consequences for mostly poor women who were struggling with addiction. And while we were in the middle of this investigation, the Supreme Court overturned Roe v. Wade. So this took on a whole new importance. Michelle, next slide, please. So this was an argument that I had to keep making with editors over and over again. You might get it from some of your editors. What do criminal cases filed against pregnant people who use drugs or test positive for drugs have to do with reproductive rights? Well, this is an attempt to enshrine fetal personhood in the law. And most of the states now, it's kind of switched to where they're using child abuse and neglect endangerment statutes to apply to unborn fetuses. This is definitely what Oklahoma is doing. South Carolina is still doing it. And under that idea of the law, anything that someone does that's perceived as threatening to a pregnancy could be criminally charged. In theory, then you could charge a woman who had a glass of wine while pregnant with child endangerment, or if she ate sushi, she didn't wear a seatbelt while driving. Witness the examples from Shoshana and Jill's reporting on women who were referred for drugs that they were legally taking or given at the hospital. There are other cases. There are cases of, because syphilis can cause stillbirths, there are cases of someone who unknowingly contracted syphilis while pregnant and miscarried or lost the pregnancy, and they were investigated or criminally charged. And that's what we're talking about here. That's the risk. And then there are cases where these miscarriages and stillbirths have been investigated as potential homicides. You can even prosecute people who give birth to a healthy baby but test positive for drugs, which is a separate story we did in 2023. Simply the fetal exposure is enough to file charges in a lot of these states. And no proof of actual harm to the fetus or child, or no examination of the test's accuracy is required, as Sho explained, right? So they're not even required to do a confirmation testing. They just have to have a urine screen, a meconium test that doesn't really show concentration, use, or time of use, or that they were even knowing that they were pregnant when it happened. So it's really problematic. You can see a lot of ways that this goes wrong. Next slide, please, Michelle. There are a lot of stories that we've done on this. So I just dropped the link in here, and we'll drop it in the Q&A too, and in the chat, or I think that Michelle will probably make these slides available to our participants after the chat. And they're on this website that we've gathered all this reporting that we've done, the story show and Jill have done, and then I've done with our partners. We've had some amazing partners on this work, but you can read them all here. Um, Things that are key to understand about these cases, and this applies to like the false positive cases that Show's talking about and these ones here. Many of the women that we end up talking to who face these criminal charges live in rural areas with very few mental health treatment options, very few substance use treatment programs. Most live in sort of maternal health care deserts, actually. So it's hard enough for them to get prenatal care. Um, and then one thing, Show and I were just talking about this yesterday, many drug treatment programs that aren't in a carceral setting won't take pregnant women because they consider it too risky. It is really hard to get drug treatment when you live in rural America. Show wrote a whole book about how hard it is to get rehab treatment in this country. It's very good. You should check it out. But if you're pregnant, it's even harder. And as I said, they're living in rural areas. So the rural hospitals where they live have often been decimated. Many don't exist anymore. So it can be 2 to 3 hours for them to get maternal health care, prenatal care. And what concerns me about this and what I think we may end up seeing is that there will be women with bad pregnancy outcomes because of a lack of prenatal care or access to prenatal care, or they can't get to the hospital in time, and they might get criminally charged or blamed or investigated for it. Because I live, I live in the areas where these hospitals are closing, so I see this, and I talk to the lawyers, and we're worried about it. Most of the women, like we mentioned, are living in poverty. They're functionally homeless, and in a lot of cases, they can't afford an attorney. They are often appointed a public defender or a lawyer who's a private attorney but does an amount of public defense work for pay. And they don't have a lot of time or resources to investigate the case. The women often plead guilty because they're so ashamed of what they've been accused of, or they fear really harsh sentences if they fight the charge. There's a case of Brittany Poolaw in Oklahoma, a woman who was prosecuted for a miscarriage, 15-week miscarriage, and she was prosecuted under manslaughter. And they actually changed the law in Oklahoma, so you can't do that. But she chose to stay and complete her sentence rather than fighting and appealing because she feared she could get a longer sentence. And that has happened. Like I mentioned, we've seen cases with 15 and 20-year sentences when they actually did try to go to trial. Juries are very unsympathetic to these women, and prosecutors often paint them in a really horrific light. Like we said, so many of the women we interviewed, they don't have stable housing. They're dependent on a family member or a significant other for housing. They don't have access to cars or transportation to make their appointments. As Show explained, that lack of prenatal care is often something that flags them for the testing in the first place. And then many of them are victims of domestic violence. We found that in that initial 22 investigation, and that carried over to several other stories we did. And then often, even if there's no drug use at all or no confirmed drug use or drug tests, they're being prosecuted in many cases for how they handle the fetal remains after a pregnancy loss. And that's a whole other story we did about abuse of a corpse and feticide statutes that they're being used against that. And some of you may have seen that in headlines recently. Next slide, Michelle. Oh, I should have, we're 2 slides ahead. I got ahead of myself, kept talking. I'll do that. So the next slide. So the one that says, but it's not just the South. Yeah. So a lot of you have heard about cases of Ohio recently. There's some cases I know of in Pennsylvania. California had several cases in the past, but they passed a state law a couple years ago to prevent future prosecutions for stillbirth and miscarriage. So that shouldn't happen going forward, but there's always a chance that law could get revoked. Based on what we've seen going on in the laws and the fact that the overturning Roe basically enshrined states the right to do what they want with this, the suspicion about pregnancy outcomes and whether somebody didn't want a pregnancy or tried to access abortion medications, that's increasing about these women, and they're getting investigated criminally for things that could have just been a medical miscarriage. Lakin Snelling is a case I've been keeping an eye on out of Kentucky. That you've seen the coverage of that. Brittany Watts in Ohio. She's suing because of what happened to her there. And that's what I always try to talk to people about, and it's what spurred my interest in this. I had noticed some cases back in 2019 when I was living in Texas where it was written about that a woman had you'll see disposed of a baby in a trash can. And when I started digging into the initial documents, what I found is that's not what happened. They had a miscarriage or stillbirth in a public restroom or public place, and they didn't know what to do, and they tried to flush it or throw it away because no one is given a playbook for what to do in that horrible, scary, traumatic situation. So when you start digging into the records, often what is covered and what the media is putting out there is not correct in the first place because they're just relying on what police are telling them. I understand, like, of course, most people don't come across fetal remains in their line of work. It's very unusual, but it's upsetting. Like, I think if you haven't ever seen this or encountered it, it can be upsetting. And so I think sometimes people have this like gut reaction to it. But often when we go back and look at the records, look at the thing, I mean, one of the cases I can think of that I covered, the woman had a infection that probably caused her stillbirth, but she was investigated as if it was a feticide. And so just be really cautious when you see one of these cases in a state where you live or you cover, ask for the autopsy, ask for the documents. That's what one of our data sets was built on in Oklahoma. We started with an autopsy set. Um, you can get that in a lot of states. The way you request it, you'll ask for like all autopsies done on infants less than 1 day old. And that gets you any, if they are autopsying. Oklahoma's a bit of an outlier in that it autopsies like everything, but if you want to know if your states are autopsying fetal remains, that's a good way to start. You can do clip searches. Like I mentioned, Alabama has like a court data set that's really specific for this. Oklahoma and South Carolina, you have to parse it out from all the child neglect charges. In most of the other states, there's a small handful of cases that have gotten coverage, but there are still cases that pop up that don't get on the radar that I find out about later through lawyers and sources. But I really encourage you guys to dig into this. It's underreported. Be skeptical. It's your job as a reporter. So now it's time for our questions. I guess. Oh, okay. If no one is going to go, if you guys have a question, drop it in the chat, raise your hand. I can get started. We have some chat because we're going to. Shoshana, I think somebody asked about one of the women, did she get her baby back? But what about Ayana? I know you wanted to talk about that case because that was important and you felt like that could be really illustrative of how this works in reality.
Yeah, Ayana Harris Rashid was a mom who kind of led our Jill's and my most recent story. And basically, she gave birth a few years ago. Very experienced mom, and also a mom who's experienced significant pain and nausea during her pregnancy, which I can relate to. I've definitely had very bad pregnancy nausea. Unfortunately for Ayana, the medication that a lot of OBGYNs prescribe for that, Zofran, did not work for her at all. And so, she faced this conundrum that a lot of pregnant women face, which is, especially pregnant women who already have children. You need to function, you need to work, you need to take care of your kids. So how do you do that? And Ayana found that legal CBD gummies and a topical hemp-based ointment alleviated her symptoms and allowed her to function. And I want to emphasize these are legal substances that you can often purchase at, a gas station or a convenience store or the grocery store. But unfortunately, these urine drug screens that a lot of hospitals use often do not differentiate between a positive for THC caused by a legal hemp-based or CBD product versus an illegal substance like marijuana, which is the case in South Carolina. Marijuana is illegal. And so when Ayana gave birth, she and her baby tested positive for THC. That positive test triggered a report to the Department of Social Services. The Department of Social Services in South Carolina has a policy of automatically referring every single one of these reports to law enforcement, which happened in Ayana's case. And Ayana, a couple months after giving birth, was in bed breastfeeding her newborn, scrolling on her phone, sitting next to her husband, and she got a call from law enforcement telling her that she needed to turn herself in immediately on a felony charge. And so Ayana did. She turned herself in. She was strip searched, spent the night in a cold and crowded jail cell, and then was released the following day. Found that due to the stress and time away from her child, she was unable to continue breastfeeding. And she eventually was able to get the charge dropped through the advocacy of her lawyer, who argued a number of things, including for one, that the drug test does not prove where Ayanna, if she did use illicit marijuana, where she might have used it. She could have used it in another state where it is legal. Um, she could have used it in a state where it's legal and used it only one time. And of course, the drug screen results do not tell you whether or not someone might have used a legal CBD product or an illegal marijuana product. So, fortunately, Ayanna was very lucky that she had the advocacy of this attorney who introduced her to me. And a lot of people are just not in that lucky position. And what I found in reviewing the reports from this law enforcement agency is that they have a tendency to arrest women on these charges based solely on the positive drug screen results. They don't do any further investigation. They typically do not interview the women to ask them questions about what substance they might have used, to see if they have receipts from the purchase of a legal product. They don't require more precise drug testing. They are literally filing charges based on a single drug screen result. And the law enforcement official that Jill quoted earlier, Lieutenant Larry Williams from the Loris Police Department, even made a point during our interview of emphasizing that he knew that these urine drug screens have high false positive rates, that a lot of women reported to their agency have positive tests triggered by prescribed medications or legal CBD products. And when he's assigned one of these cases, he interviews women to find out what they might have taken. But it's very much based on whoever receives that report. And so if a report of a woman who used illicit substances allegedly is received by a police officer or prosecutor who is more inclined to charge based on what they see on paper, then that is most often what is happening. And even Lieutenant Williams, said if they're unsure, even when they suspect it could be a false positive, they often err on the side of the baby, as Jill put that quote up earlier, and arrest the woman. So there's real risks involved in these positive tests.
I think that's such an important point, Show, because a lot of people don't realize, and what blew my mind when I first started reporting on this, because a lot of the people that I write about, and you've written about, are accused or test positive for meth. Well, meth sounds like a big, scary, bad drug, especially for those of us that have covered it like for a long, long time. But there's actually no concrete proof that meth is harmful or causes stillbirth or miscarriage. It's a misconception that a lot of people have about it. I mean, I think I probably, before I started researching this, would have thought the same thing. But you also, because there are people who take ADHD drugs while pregnant. Not everybody does, but some people do. And the point of fact, that is an amphetamine. So how the experts, when I started doing this reporting, they kept saying, well, if meth kills babies, and how come so many healthy babies are born exposed to methamphetamine every day, including ADHD drugs? And it's exactly what Show's talking about. They don't really do confirmation testing. It could be like some other kind of medicine that's getting them flagged. The prosecutors we've talked to who have been seeking very long sentences, when I try to call them out on this or try to ask them questions, they'll usually say, well, I'm just trying to get her into treatment. We're just trying to get her into treatment. Well, what they mean is prison, because there's not like a treatment center that's going to take them. And so, it's very problematic. And one of the cases that we found in Alabama where the woman had enough money to get her own lawyer, and she got a really great legal team around Huntsville, Alabama. And they actually filed a motion with the state, because in Alabama, you have the right to have your evidence independently tested, the state's evidence against you. And they found that the state had actually destroyed the placenta and the sample that they used for testing against her. So they got the charges thrown out. But that rarely happens, right? And so that's how little this science is actually vetted. It hardly ever makes it to a courtroom. It doesn't get vetted. So that's why we're encouraging you to really dig in and be skeptical. Somebody had a question in the chat that I wanted to ask. And I didn't know the answer to this because I've certainly asked hospitals. I've not found them to be forthcoming. We were trying to ask all these hospitals in Alabama, like, who's paying for this meconium testing? Why are you having this done? Someone wanted to know, how do you ask a hospital what their drug testing policy is for pregnant people?
Yeah, I mean, I honestly, I've had the same experience as you, Carrie, for the most part when I've contacted hospitals, which we do for every single case that we report on in these stories. Most do not provide that information. One hospital did, the case of Susan Horton, who ate the Costco salad kit with poppy seed dressing. That hospital network was Kaiser Permanente, and they actually did provide information about their policy, confirming that they drug test every single pregnant person. But yeah, I would say it's totally up to the hospital. You might have more luck, perhaps, I think, with publicly funded hospitals or state university hospitals that may fall under public records laws. But a lot of these private hospitals, it's totally at their discretion of over whether or not to give it to you. I think one potential avenue, but I think this is risky, is to, if you're interviewing a patient who's had this experience or who's curious about this, they, as a patient, can ask for those policies, and they're often entitled to them. So that's one avenue worth pursuing. And I will say, as a pregnant person currently and also previously, when I first started hearing about this, I asked my doctor what the drug testing policy was. And this is my previous doctor. The question was met with a bit of suspicion. I did not even get a response from my doctor. I got a response from like the person above her. Maybe that's because they knew I was a journalist, or maybe they were concerned that I was a substance user and wanted to, figure out what my motivation was for asking. But from that experience, I feel like there is a bit of a risk for a patient to ask their own doctor for this policy. But I also think that now that these stories are out there, we have this entire body of work about hospital drug testing policies. That is a very valuable tool that either you or a person that you're reporting on can use to go to your medical provider and ask what the hospital drug testing policy is. I see there's been these news stories about hospital drug tests of pregnant patients. I'm really curious to know what this hospital's policy is. And there's a whole host of follow-up questions that are worth asking. I think we actually have like a mini guide for how of questions to ask, how to navigate this possibility with your healthcare provider that I think could be useful if this is something you're interested in pursuing. And we can put the link in the chat.
Yeah, I haven't figured out how to put the Q&A won't let us just drop links in there. I think you have to drop them as an answer. Jill, there's a great question here for you about the data and how the states that where you weren't able to obtain the data, what were the most common reasons that you weren't able to get it? And among the 21 states that you got the data for, which states were the most challenging and why? So give us the caveats.
Sure. So the way that we got this data is that this is voluntarily submitted data. So when you see the word voluntary, oftentimes that means, okay, you're going to get some data, but not all data because not all places are going to submit it because it's voluntary. So the data that we have starts with child welfare agencies in each state and gets reported up through to the federal government, to the Federal Children's Bureau. The Children's Bureau then works with an organization called the NDCAN, the National Data Archive on Child Abuse and Neglect, which stores this data. It's a data archive for the Children's Bureau data. The NDCAN is where we get the data from. So it's sort of a circuitous route where child welfare agencies submit to the federal government and store it somewhere, and we get it from the place that stores it. But there isn't vetting of the data along that pathway. So the data that we got only covered around 20 states, and we very intentionally went back to every single state that submitted data to ask them whether the data was accurate or not. And only about half, about 10 states said it was accurate, which is shocking when you think about it, because this is data reported up through the federal government. And I think it's a really good reminder that just because you're looking at numbers and it's submitted by a government agency doesn't mean that they're accurate. and why you should always go back and check, especially if the place that originated the data is not the place you're getting the data from. So that's why it took so long, the better part of a year, to go back to each state. We heard things from states like, we don't gather this data. We don't collect this data at all. We heard from states that this data is kept at the level of the county because we have a county level child welfare system, and so it's not collected at the state level. There was one state, Texas, where the data that was collected and provided to us through these federal channels showed that there were not so many cases referred to law enforcement when you take into account how many allegations there are of substance use during pregnancy in Texas. But when we talked to the Texas Child Welfare Agency, they said, we have no idea why that data looks the way it does. It is just wrong. We refer every single case that we get to law enforcement. So we had to completely rework that data. So it was really this back and forth. There are states that they submitted things in error. Like I think it was Arkansas that said that they submitted data in error because every time a form was filled out, they submitted it, even though not all those forms indicated actual referrals. You can see how this process just goes on and on and on. But then among the states we got data for, you asked which states were the most challenging. One other thing we did is for certain key states of interest that didn't report to the federal government, we asked if they would provide us data directly, and then tried to make it sort of harmonize with the data we already had so we could include it in our counts. And part of the challenge of that is, making sure they're keeping and providing data in the same way. In South Carolina and Kentucky, we actually got to this in a bit of a backdoor way. We were able to confirm that they refer every single allegation of substance use that comes to child welfare to law enforcement. We were able to get counts of how many cases they have, and we were able to incorporate those into our totals, and made very clear to these states what we were intending to do. So it was actually several different avenues that we went through and a long verification process to get to where we ended up.
That's really cool. I mean, the work that went into this is just incredible, guys. We have a really interesting question from one of our attendees today. Show, you're probably the best one to answer this one. She asked if, since the FDA strongly advises against THC and CBD and topical hemp lotions during pregnancy and breastfeeding, are doctors warning their patients about these products and about the risks of mothers being tested or referred to police for using these consumer products? I think it's such a great question. And I was just thinking about one of the women I wrote about. She talked about what she was actually testing positive for was like a synthetic marijuana product that you can buy at the gas station in Alabama. So, what are you hearing from medical
Yeah.
experts?
No, that's a great question. I will say also the scientific studies on exposure and the effects of it are very mixed, and methodology is not always sound. So I think that's one thing worth questioning when thinking about this. But I mean, I will say that in most of the cases that I've looked very closely at, doctors did not issue warnings about drug testing or what the impact of the drug test could be, and there's very little conversation. I would say for the most part, women are discouraged from using marijuana or CBD products during pregnancy. But there were several women that I interviewed who, were very open with their doctors about the challenges they were having, that they were unable to keep food down, unable to keep water down, and informed their doctors that because of that, and the fact that medications prescribed to them were not working, they were using CBD products instead. And there were several instances that I learned about through some of these patients where doctors were like, okay, I mean, I don't encourage it, but if this is working for you, then good. Because of course, if a mother is not able to keep food or water down, that is going to have a very negative impact on her pregnancy and the developing fetus. So I think that some providers are having more open conversations with women about this. oftentimes, even so, it's not necessarily to the extent of, well, because you're using this substance, you are maybe drug tested and reported to authorities. I think that's something that women have, that when this happens, it comes as a huge shock to them. And, like, I think it's interesting too that the military actually advises service members not to eat poppy seeds. Don't eat poppy seeds because it'll cause a positive drug test. That is not something I ever heard during either of my pregnancies. And most women I interview about this have never heard that warning from their medical providers.
I think that's great. And we definitely have had stories about it. I think there are women in states like Oklahoma where you can get a medical marijuana card, and women had medical marijuana cards and they were getting prosecuted anyway. I can think of a case, I didn't bring it up because we're trying to keep it like limited. We have so many cases, but there's a case in Oklahoma where a woman found herself pregnant. She was struggling with substance use disorder, and she actually had checked herself into a rehab that would take her while she was pregnant to get help. While she was there, she started having heart palpitations, like heart issues. And so they sent her out from the rehab to an emergency room in Oklahoma. And which they don't have doctors to treat pregnant women in the rehab there. So I understand why they did that. Well, while she was there, they filled out a form, like, here's your form to consent to drug testing, whatever. She was honest about it. She said, I relapsed, I'm in drug treatment. The nurses who were there to treat her were the ones that called the police to the emergency room. And
Wow.
they came and got a blood draw and tested her, and that ended up getting her child taken away, and she got jail time. So I think there's a lot of misconceptions even in the medical community about this, and even people are trying to do their best. I think a lot of the doctors I talk to, someone who works in the legal system gave me this really excellent insight. They said, doctors and nurses and people like that are often told, well, you're a mandatory reporter, so you have to report on the law. They have to call child welfare services. Most of them don't necessarily know what happens after they make that call. I think it might have been a lawyer who was in New York, and they were talking about they were taking doctors to the family court system in New York City. And a lot of the doctors were like, this is what happens after we call. We had no idea.
Yeah.
Like they just weren't aware of it because it's beat into their, head. Like, it's the law, you have to mandatory report. And so it's a real discussion in the medical community now. Like, do you need to test? Like, once you have the test, what do you do with it? Shouldn't you confirmation test? So I think there's a lot to be done in terms of the science and the knowledge and the messaging.
That's such a good point, Carrie. Yeah, I think a lot of people just assume that, this will lead to help for the family when
Yeah.
that's not always the case.
Well, I'm just like agog at how many people turned out for this and the excellent questions we got. I always love talking with these colleagues about this. We will talk about it all day long because there's just so much, once you start peeling back the layers of the onion, that's really interesting. There's so many excellent experts in this area. You can find them through different groups like Pregnancy Justice. There's a lot of expert medical sources that you can find if you need help with. We've got, do you want to throw up our contact information slide, Michelle? She's going to send this to you, but you guys should all have our emails. It's easy to find on the website. If you're ever stuck and you want to do a story and you're looking for sources, we're happy to talk to you if you want to email. There's so many good experts and people that are researching this and doing work. There's a lot of really hardworking public defenders and defense attorneys out there trying to, make sure that these people get fair representation in court and that the science is examined. So shout out to them because they are often terrified to talk to us on the behalf of their clients. But I think it's really important, and I can't say enough about the brave people who've shared their stories with us. That is such a difference maker. They really help, like, I think, dispel some of the myths about what people think about a mother who may have used substances while pregnant. There's always way more to the story, and that's just a huge part of our mission at the Marshall Project. So we are so glad that you guys were interested in this topic and took the time out to sit with us today.
Oops, sorry.
Is that your timer? Someone's already trying to pull show into another meeting. All right. Thanks for joining us, guys. Bye, guys. Thank you.